Fractures account for nearly 20% of all martial arts injuries, which, to be honest, is quite a lot. Let's look at all of them one by one. Hand fractures. The irony of the boxer's fracture. The boxer's fracture breaks the fifth metacarpal, your pinky side knuckle. It represents 10% of all hand fractures in emergency departments, with a male to female ratio of 5 to 1. But here's the ironic part that'll blow your mind. Trained boxers rarely get this injury. It should be called the bar fight fracture or the untrained guy fracture. Professional fighters punch through their second and third metacarpals, index and middle knuckles, which are anatomically stronger. Untrained fighters instinctively throw wild haymakers that concentrate all that force on the weaker fourth and fifth knuckles. Your body's natural instinct gets you injured. But the scaphoid fracture at the wrist? That's the truly dangerous one. It accounts for 60 to 70% of all wrist bone fractures and has a terrible blood supply. When it breaks, blood flow gets cut off and the bone can literally die. That's called avascular necrosis. Worse, these fractures often don't show up on initial x-rays. Doctors misdiagnose them as sprains constantly. It's the most frequently missed fracture in malpractice lawsuits. You think you sprained your wrist sparring. 6 weeks later, you find out part of your wrist bone is dead. Then there are thumb fractures, Bennett's and Rolando fractures. These happen when beginners make one fundamental error, tucking their thumb inside their fist. The Bennett's fracture dislocates the thumb base. The Rolando fracture shatters it into 3 or more pieces requiring surgery. One mistake, one punch, career over. Speaking of technique mistakes that cause injuries, let me tell you about jab AI. These fractures happen because of bad form, improper alignment, or not knowing the mechanics. That's exactly what jab AI helps you catch before you end up in an emergency room. We all know nothing beats a real coach, but what if you need feedback at 2 a.m.? Or want to analyze your striking form during solo heavy bag work? Jab AI is your 24/7 second coach, generating personalized training plans and giving you expert voice-based cues during workouts. Whether you're perfecting your punch mechanics, analyzing your defensive positioning, or breaking down sparring footage to catch errors before they cause injury, Jab AI helps you train smarter and safer. Available on both the App Store and Play Store. Now back to the brutal stuff. The catastrophic leg break. When shin meets shin during a checked kick, you get the most horrific injury in martial arts. Anderson Silva, Corey Hill, Chris Weidman, all suffered complete tibia-fibula breaks from the same mechanism. Here's the physics. Your shin bone near the ankle is thinner. When you throw a kick, that part is traveling at extreme velocity. Your opponent checks it with their shin near the knee, which is denser and basically stationary. They're moving backward, absorbing some energy. You're driving forward with all your power. Your momentum has nowhere to dissipate. The bone doesn't bend, it snaps. Silva needed a titanium rod inserted from knee to ankle. His surgeon confirmed the bone was completely normal before the break. This isn't about weak bones. It's pure physics meeting physics at the worst angle. Stress fractures are different. Muay Thai fighters throw 500+ kicks per session. That creates microfractures that become complete breaks without adequate recovery. Bones need 48 hours minimum to repair microdamage. Skip that rest? You're not conditioning your shins, you're fracturing them. Facial fractures, getting rearranged. Nasal fractures represent 84.7% of all facial bone fractures in combat sports. Your nose has minimal resistance, just paired bones and cartilage. Professional fighters have 1 in 4 career odds of breaking it. Repeated breaks create saddle nose deformity, that characteristic sunken boxer's nose. Orbital fractures, eye socket breaks, are brutal. Direct impact increases pressure inside your eye socket. That pressure releases through the orbital floor, which is only 0.5 millimeters thick, thinner than 2 sheets of paper. Complications include double vision in 83% of cases and a permanently sunken eye when the socket expands. Sage Northcutt got 8 facial fractures from 1 knockout, 9 hours of reconstructive surgery. Cub Swanson took 7 jaw fractures from a flying knee, resulting in permanent facial nerve damage and complete loss of sensation on half his face. Jaw fractures hit the mandible angle most commonly, exactly where hooks land. Takes 70 to 100 pounds of force to break. Fun fact, knockouts and fractures work differently. Knockouts come from rotational brain acceleration. Fractures need localized force exceeding bone strength. You can get knocked out without breaking anything and break your jaw while staying conscious. Grappling breaks. When egos snap bones. Submission injuries happen because people refuse to tap. It's that simple. Arm bars typically damage ligaments first. Studies show 100% of elite grapplers who get arm-barred tear their UCL. Fractures occur in less than 5% of cases. But when you don't tap, Frank Mir's armbar on Tim Sylvia created 4 separate fractures, 2 radius, 2 ulna. His bone folded like a lawn chair. 16 years later, he still has screws backing out and recurring infections. Permanent damage from 3 seconds of ego. Kimuras produce spiral humerus fractures through rotation. When Mir caught Nogueira, Nogueira refused to tap. His upper arm bone spiraled under torsional stress like a twisted towel. First submission loss in 42 fights. The spiral pattern mirrors arm wrestling injuries where rotation fails the bone along its weakest plane. Heel hooks are the most dangerous submission. They attack ankle and knee simultaneously. The inside heel hook is devastating because your ankle can't rotate outward. All force transfers to your knee. Documented cases include butterfly fractures of both lower leg bones, with one competitor needing 3 titanium rods. Prevention. How to keep your bones intact. Proper fist formation. Curl fingers tight starting from pinky, lock thumb over curved fingers, never inside. Align fist, wrist, and forearm straight. Land with first 2 knuckles. Hand wraps aren't optional. They compress all 27 bones and distribute impact across your entire structure. Shin conditioning follows Wolff's Law. Bones adapt to stress. Progressive heavy bag work, 150 to 200 kicks 3 times weekly, creates microfractures that heal denser. But you need recovery. 48 hours minimum between sessions or you get stress fractures instead of conditioning. For grapplers, tap early. Always. Arm bars before hyperextension. Kimuras before shoulder rotation. Leg locks immediately. Your ego heals faster than titanium rods. Learn proper break falls. Correct ukemi keeps head acceleration below injury threshold. Without it, direct head contact causes 60% of brain bleeds in judo. Don't forget to check out our app Jab AI for proper technique analysis.